안녕하세요. Today I will talk about chapter 27 from book Pediatric Dentistry Clinical Approach. Chapter 27 Ethics in Pediatric Dentistry. I will talk about biomedical ethics, informed consent from the perspective of pediatric dentistry, and also deciding on the treatment and integrity and the autonomy. Also challenge in pediatric dentistry meeting fellow neuropal children and research involving children and adolescents. Introduction. Ethical aspects in pediatric dentistry start right there in the clinical with child patient we meet as dentist. The child patient that we should be able to communicate with and to whom we are responsible for providing the dental treatment and oral health based on the best available scientific knowledge in combination with clinical understanding and experience and taking the patient's point of view into consideration. Ethics in the context of a pediatric dentistry very much concerns how we look upon children as individual and as a patient. One important aspect in this course on the Convention on the Rights of the Child, organizing in 1989 and now ratified by the majority nation worldwide. The convention is founded on the 54 articles, and articles 2, 3, 6 and 12 are usually identifies a major importance. The conventions applies that to children and adolescents below the age 18 and state the children actually have rights defined in the Article 1. This essentially and really the basis for understanding the conventions. The child has the right to life and development and should be listened to be respected person and human being, being protected against the health hazards and discrimination, punishment. Biomedical ethics. Duke-Raton's University in Washington, the four values are the principle of autonomy, non-maleficence, the first one, the autonomy and non-maleficence and beneficence and justice. The treatment is delivered by someone, and if that professional, for example, the dentist, does not agree with the treatment demanded by patient, he or she is not obligated to carry it out. Non-maleficence is an old and well recognizes the principle that goes back as for as a Hippocratic oath that we should not harm patient at the first cadence. That may be considered easy, but it's not always so. For example, some dental treatments are painful, and from the perspective non-maleficences might therefore be on the borderlines according to this principle. The principle of beneficence has very strong position in all healthcare. It is on the interest and good the patient as well as society and concerns in the idea ensuring that will delivery effect and good treatment. The principle of the justice state that every person should have the same and equal right to access the same kind of dental care and treatment regardless of the age and gender, social position and education and ethnic background and religion and so on. For obvious reasons, the principle may be hard to abate by institutions. There is shortage of dental care as well as of the finances. Informed consent from the perspective of the pediatric industry. The paternalistic perception that the doctor know what is the best is now being questioned and replaced by the idea of the patient having much more to say about her or his own treatment. The child's autonomy is often looked upon and with difficulty than that of adult patient. That is why communication is important. The dentist is able to describe to the child what need to be done, why and how the child will be able to talk, uh, take the part in the decision and making, and the dentist can in fact receive informed consent from the young patient, but the information must be age appropriate and the child must feel safe and comfortable in the situation. Integrity and autonomy. Integrity and can be described as right and the person has to have to area protected against intrusion. For example, private sphere and space where human dignity is central. Every person or human being has integrity or dignity as it is present right from birth, but it can be transgressed by other. This is easy done if you are not observant of your own behavior and fail to remember that the child is your patient and their offer should be your main concerns. Sometimes difficult parents act uh, the parent, the child, patient, uh, and to individual to knowledge and communicate with the order perspective integrity, while at the same time maintaining a respectful attitude toward the parent. In this table, uh, show the level autonomy varies throughout life depending on the individual capacity. Autonomy, we mean the right person to decide about her or himself to be committed person. Autonomy also in dental care situation allows patient to decide if she or he want to through treatment or not. Autonomy also severe shield protecting person integrity, and the contrast to integrity, autonomy is not always present, it has to be on. Newborn child cannot be exercise the autonomy. Instead, autonomy is gradually gained as the child develop and by age or growth the older. Deciding on the treatment. In many cases of ethicals analyze will reveal that much treatment actually can be postponed. There is freedom with a few exception need to immediate treatment and very rarely condition that are life threatening the dental care. Also, in the case it may or through for be more acceptable from ethical point of view if the treatment is carried out even though the child is protesting. The dentist should be, of course, do everything to make it easy or easier for the child to cope with the treatment. This should include prevention of the pain and possible also using sedation. challenging in the pediatric dentistry meeting uh, vulnerable children. It is obvious in this case the children's general health was already affected, had pain and problem when eating, potential risk for malnutrition if left untreated. It can also be regarded to though infection should not be left untreated. They may be fact spread. Research involving children and adolescents. Research is an important part of odontology in both orders and evaluate the existing treatment methods and to develop the new ones. Research involving humans has dark history and act crucially have been carried out in the name of the science. For example, prisoners of the war and refugees in the concentration camps during the World War II. Every researcher must deal with some ethical consideration when doing research involving human beings. First, the people are going to be involved. It must be high quality research. Second one, the possible risk for the person participating must be far outweighed by the benefit of the participating. The third one, the person must be receive under stables and the for children age appropriate information. Thank you very much.